Hello everyone. Here we'll learn how to draw different phases of action potential. Starts with resting membrane potential, and this is the stimulus artifact, and this is the phase of latent period. Latent period is time required for transmission of impulse in the nerve fiber towards the electrode. So then it is initial depolarization, which is going to reach to uh, the threshold level where, and the next phase is rapid depolarization where the action potential, the membrane potential is going to reach to plus 35. Then the phase of repolarization. So this is the phase of repolarization. At the time it reaches to the resting membrane potential, it is delayed, and the phase is called as after depolarization. Then it reaches to the resting membrane potential, then it hyperpolarizes, and it goes beyond the resting membrane potential, the phase which is called as after hyperpolarization. Then again it comes back to resting membrane potential. If you see the ionic basis for the different phases of action potential, uh, the initial phase of depolarization is caused by the opening of the sodium channels, which are uh, mechanically sensitive. So, and when it reaches the threshold, it leads to the opening of the voltage gated sodium channels, so which causes tremendous influx of sodium, uh, and there occurs a Hodgkin cycle, which is a positive feedback mechanism through which a large amount of sodium ions enter, and the membrane potential reaches up to plus 35 millivolts. And at this point, the voltage gated sodium channel closes, and the voltage gated potassium channels, they open up, and which are going to leads to the efflux of potassium. So gradual efflux of potassium leads to the rapid repolarization. And at this point where the after depolarization starts, it occurs because there'll be delaying in the repolarization, which occurs because of the accumulation of the excess of potassium ions in the ECF, which delays repolarization. And once it reaches the resting membrane potential, the continuous opening or delayed closure of potassium, which causes loss of potassium ions, which makes the membrane potential more negative, that is, it goes beyond the resting membrane potential, and the phase is called as after hyperpolarization. And sometimes because of the closure of uh, the potassium ions, sometimes the membrane potential goes uh, uh, towards the positive side, which will be taken care by the sodium potassium pump, which is going to pump 3 sodium out, and 2 potassium inside, and it helps in the balance of the resting membrane potential. It brings back the resting membrane potential sometimes.